Ding. Hi, I'm Grace. I'm going to be your student nurse today. We're just going to be administering those morning meds. Before we get started, can you go ahead and confirm your name and date of birth for me? Antoine Jones. Perfect. Do you have any allergies? Morphine. All right. Well, we will make sure that that is updated. Okay. If you have any questions for me at all while we're going through this, you just let me know. First thing that I'm gonna do is show my injection sites of where I can give my IM intramuscular medications. So I can give an IM medication on the deltoid, so I'd find the cornea process and I'd put my fingers, 2 fingers here, and I can give it right here. I could also do vastus lateralis, which would be right here, and I can give it anywhere on the lateral thigh right there. Third spot is going to be the ventral gluteal, where I'm going to put my hand on the anterior superior iliac spine, like this. And then I'm just going to turn, and I can give it right here, in between my 2 fingers. And then for insulin, I can give it within 2 inches of the umbilicus, anywhere around. For the TB or the PVD skin test, 2 fingers here, other vein elbow, 2 fingers here, and I can give it anywhere in between, right here. Right.
Well, that's what every professor's gonna tell everyone.
My hands are already dry. I would do hand sanitizer and change gloves.
With the exact same name.
Yeah.
So it's completely up to you.
It's not easy to see.
How far away is your dog? How far away does he live? Your dog?
Well, he lives here. Now he lives
I have my ampicillin. It's an antibiotic, and a 22 gauge, 1.5 inch needle.
Emory.
It is 6 milliliters, so I would split this up into 2 different syringes and I'm giving this on the ventral gluteal, so I do it one on each hip.
Some health science degree and became like something like he worked for the Cincinnati Bengals. He traveled with them for like a couple years, and he realized that he wanted to be a PA because I guess he shadowed or like had a friend that did it. So then he like reapplied, and he said for him it was easier because like he said he still had a good GPA, but he said he applied with 10,000 clinical experience hours. So he's like, I can kind of get in anywhere. He's like, for you, he's like, it shouldn't be more difficult. Like, you're not going to have near as many clinical experience hours. He's like, your GPA is going to count a lot more. But he said,
Giving
if
this
I
during
like
the Z-track method.
No, you haven't even been through the pre.
PA, well, there's no like pre-PA classes. Like, you know, like nursing, there's like nursing 102 before you get in. There's no like PA 324. It's just science.
Yeah. But I get it from being on speaker, so do you want to be? I'm that way with a phone.
Hold it.
My phone is
Like,
old, but.
Would you like to be a doctor? Yes,
I would like to have more authority. It's like, maybe.
So that's the biggest question.
Alright, I would flip this
If it works.
and put it in
But
sharp
is it like an PA doctor you are?
immediately.
I know, and that's why.
And
That's why I
a
was
Band-Aid.
PA is because like if you ask people who are in like healthcare, a lot of them say that
We're
PA
gonna
is
give this
doctors
insulin.
outside the hospital.
Before I give this, I just want to make sure that their blood glucose has been checked, which it was. You're giving 4 units of insulin.
I know, and I know that getting into that school, just getting into it is.
And then when you get there, it's hard. It's gonna be hard no matter what.
Yeah.
But you can do anything you want to. Anybody can do anything if they want it bad enough, right? Anybody can. And you gotta think about what makes you what is making you happy or like what makes you happy, right? You gotta think about that too. Because
I
that's not
just,
everything.
like, when I think about, like, I don't know, like, the type of person that I am and everything, I feel like I would be better, like,
Okay.
the more, like,
Just gonna pinch.
medical side of it.
If you can't get an inch of skin, then I'm gonna go in at a 45
No,
degree
but I mean,
angle.
like, more than, like,
But
holistic,
I do
like,
get a
when I
good
think of
pinch, so
nursing,
I'm gonna go
like,
90.
if that makes sense.
I do nothing.
Well, you're also
Sharps
just like an
immediately.
Yeah, but
which I guess I could go that route too.
I do.
This one, so we're gonna be doing our Edison test. Real fast, Mr. Jones, can you have this read within 48 to 72 hours? You need to be able to have it read within 48 to 72 hours before you give this. Okay. It's 0.1 milliliters of PBE.
It just like depends where you are.
Yeah.
Because you can do anything as a nurse. You can do.
After so many.
You can somewhat do any specialty. Maybe not.
We got a wheel,
With some experience.
sharps.
But that means you have to become 100% competent in every single aspect of that specialty. If I tried to go into neurology, I don't fucking know.
Hand hygiene, change gloves.
I would not do it.
Right.
Yeah.
If I went and did,
Next thing that I'm gonna do is go ahead and give my IV medication. This is Toradol, 25 gauge 1-inch needle. It's given. IV push rate is 1 milliliter per minute. And before I administer this, Mr. Jones, can you go ahead and rate your pain for me on a scale of 0 to 10? 0 being no pain at all, 10 being the worst pain you've ever felt. Out of 4? Alright. Would you like me to administer this pain medication?
Well, that's the problem. Because
I would have choked. I was like,
Like,
oh, yep.
certain,
really?
yeah.
If you want to see, like, what it is.
But it's like,
I had earrings in right before I went in.
I'm just gonna
If you
flush.
just let me know, like, I just think, shadowing over is what decision you make, you know?
yeah,
Because technically, like, nothing's set in stone.
yeah.
If you've never been in either of these settings,
Needle that goes into sharps.
you need to study, like, what it is, and then that will give you more of a clear direction and answer.
Yeah, in 30 seconds.
That's really, really, really what I like.
What's difficult is like, I would love to like finish this semester
Okay.
regardless, but like, the problem is like, because I was talking to him about it, and I ended up like, I was like, I'm doing great in all my lectures, and then I was like, no.
I didn't work on it today, I know it.
Set for it fully, and when I was talking to like my doctor who's PA, I was asking.
And I also set my flush down, so I just open up a new one, because that's not sterile
He'd be like,
anymore.
"Want me to charge that?" And I was like, no, I get one more.
And flush over the same rate.
Look, he's like, there's a chance that you fail this. He's like, and you like genuinely want to be in PA school. He said you can't take it because he said if you fail that, he's like, no case for me. If you fail the nursing.
They would say, it's not the same thing. Please, that is like not correct at all. I'm telling you that, honestly. Do not.
Just put them sharps. Hand hygiene, change my gloves again.
But what did I just say? Like, you want it bad enough, you can make it happen. I don't think there's any if. I know
Okay.
you're not.
I'm just gonna sit you up, Mr. Jones.
I do, but like every single person who's ever failed it twice.
No, that's.
Okay, maybe not everyone, but like I was so locked into that. I had missed the Saturday practice. I had missed the Friday
I know
practice.
you haven't, you've been working on it, she sees that too. I promise you do.
Sorry, Mr. Jones, we have a squeaky bed. You're doing great.
My hand went through my waist.
Okay. I'm just gonna make sure that he is set up all the way, that way I can. Okay. Now, before we do anything, I'm just gonna have you take a sip of water and then you need to swallow it, okay? You swallowed it. We're just checking for the gag reflex, make sure that it's present. Okay. First thing that I'm gonna give you is we're gonna go and do our prednisone. Now, I have 2 tablets of prednisone. I have one in my bag, but I would have 2 because these are 10 milligram tablets and the order is for 20 milligrams. So,
Because it starts getting like.
I'm gonna go ahead and have you take this. Swallow. And then here's your metformin. This is just for your blood sugar. And take a sip of water. Perfect. Now for my ondansetron, that's sublingual, so I'm not gonna give that yet. I'm gonna wait. We're gonna go ahead and do our albuterol. This is just a steroid. It's gonna help you breathe better.
And then tweak the note for the sugar. That's it.
Right.
It's not full on.
Right. I'm gonna have you take a couple deep breaths in, out, in, out, and on this last one, in and swallow, and inhale fully, and go and take a sip. In, out, in, out, in.
You need a shadow. You need a shadow though. You need a shadow first.
I should have shaken that before I primed it. And then I'm also going to have you
Very clear.
swallow some water, or no, do not swallow. Take a sip of water, rinse it around, and spit it back out. This is just going to prevent thrush, which we do not want, because you would be in here for a whole lot longer. Okay, we're also going to go ahead and do our cortisone. I'm going to have you take a deep breath in as I spray. In. Perfect. And one more. In.
And then they usually
Awesome.
back tooth in one day and you can just see what they say. Tell them what you
Okay.
think.
And then the last thing that I'm going to give is your ondansetron. This is just going to help with some nausea.
For any
But do not swallow this. I'm going to have you put it on your tongue and leave it there. And then after it has fully dissolved, we can get some water, okay?
I know it is.
Right.
That's why I had I had false messages.
You still doing okay, Mr. Jones?
So, enough about rice. No mind be friends with him. Be for real. That's what he's talking
You're friends with like everybody, bro.
about. They're just not like me.
You've been added on
You ever-
Snap.
you ever met- you ever meet that-
15 people in the program.
You ever
You know how
meet
many people have added by Snap?
You ever meet that boy?
Okay.
They just bitches you.
First thing that I'm going to give is Timol. These are going to be
Not hers?
eye drops
No,
for glaucoma. Before I do this, I'm going to assess the pulse and the blood pressure.
yeah. I told her that Molly's gonna replace it. She's gonna last part of that.
One drop,
We're going to practice Saturday.
one drop. And then I'm just going to hold these inner corners for 5 minutes to prevent systemic effects.
Thank goodness. They just have like second, third, fourth semester and like Dr. Shoemaker in there. And like they've been helping.
This is a fluoxetine.
Today I think it's
Goes in
like.
your right ear. And after I administer this, I'm going to need you to lay on your side or keep your head turned for 30 minutes.
Fridays is.
Just so we can make sure that those eardrops stay all the way where they're supposed to be. I'm just going to brace them with my leg.
2 to 5.
Might be 2 to 5.
No,
They
it's
take
like
3
3
hours apiece.
But like you can just go ask like study questions or.
Advice. I mean,
I'm just going to massage the tragus, make sure it gets all the way in
yeah,
there.
that's what we
And then Mr. Jones, just keep your head turned, okay?
Because they're at like mental health right now, so like you should know. They'll help you out. Full to the floor.
And I'm just going to put
Full to a practice
Spencer
Saturday.
table back by him. And the collar.
Next time we get on the phone, 'cause I need to get straight from my instructor.
The collar.
I'll FaceTime you from Itchy Boy Ace at TikTok.
Mr. Jones, do you need anything else from me before I go? If you start feeling any different or you have any problems, just press that call light and we'll come check on you, okay? Right, thank you.
I'm not
Bye-bye.
joking. You think